Welcome back. A PC MPP is weighing in on the provincial government's ongoing negotiations with optometrists, and she's speaking out against the Ministry of Health's handling of those talks with the Ontario Association of Optometrists. We're joined live now here on the show by Gila Martow, the PC MPP for Thornhill. Thanks so much for making time.
Thanks so much for covering this important issue.
So I want to talk about a bit of background before we get into what's going on now. The province offering an 8.49% increase. That accounts to about $48 per exam, also giving $39 million to cover costs that were incurred over the last decade. Explain to us why that's not enough.
So this is an ongoing problem for over 3 decades. The medical doctors have an ongoing process with monthly meetings. It's a negotiation process that's been set up. The optometrists have asked for that and have not received it. The optometrists haven't had a contract in 10 years. They've had a $4 increase since 1989. I graduated optometry school, full disclosure. I'm an optometrist. I'm not practicing, but I am an optometrist. And this is, I think, unsustainable. And I did a presentation for caucus soon after I was elected, and I explained that this was a dispute that was going to be coming up, and we should get ahead of it as opposed to being behind it, which I feel we are behind it now. The optometrists have no choice. They're not allowed to charge their patients for an eye exam if that eye exam is supposed to be covered by OHIP. And I think people have trouble wrapping their heads around that. But the fact that the optometrists have withdrawn services is a desperate, desperate move after really 3 decades of every year being paid less because the cost of living goes up, the cost of the equipment goes up, and the whole profession has completely evolved in a much more medical field than it was when I graduated optometry school. Optometrists now diagnose diseases, they treat diseases like glaucoma, they write prescriptions for eye medications, and I think it's really time that we ensured. Sorry.
That's okay. I want to ask you about the cost of those exams. This seems to be something that is still under question. The minister, Christine Elliott, saying the actual cost of providing OHIP-funded eye exams at this point need verification. I'm wondering, why is this so hard to figure out?
I think it's not hard to figure out. I think it's disappointing. I think that the government is worried that if suddenly they start negotiating with optometrists, that other medical fields, dentists, nurses, other healthcare professions are going to demand more attention. And I understand that and I appreciate that. But the fact remains that across Canada, our optometrists in Ontario are paid about half of what the other optometrists are paid, in some cases a third. And I'm not comparing apples to oranges, even though it is a little tricky sometimes. Some provinces fund every 2 years, Ontario funds every year. All of this should be on the table, and we should address the fact that the optometrists are not able to cover the costs of delivering the eye exam, let alone pay themselves a salary for the eye exam. And that's not, it's not sustainable.
So
no other way to put it.
What would it take for optometrists to be able to strike a deal with the province at this point?
So the optometrists are asking the government to look at the independent study that was done at the cost of delivering the service, what it costs an optometrist for equipment, rent, and staff to actually deliver an eye exam, and it was found to be about $80. So the optometrists are asking for the government to declare that they will ensure that when the optometrists come back to the negotiating table, that those costs will be met, or they want to have a rigid, permanent process in place similar to the medical doctors in order to come back to the table. So it's one or the other for the optometrists to return. They already went to the table and had negotiations and spent tens of thousands of dollars on lawyers and mediators, only to be met by a blank virtual screen for hour after hour, then given an ultimatum without any discussion. The ultimatum was put out publicly, even though both sides had signed a confidentiality agreement. It's really unfortunate. The optometrists feel sort of backed into a corner with no options, not able to deliver service to their patients who are telling them that they're driving to Quebec, driving to Manitoba, and now driving to New York State to pay for eye exams that our optometrists would be absolutely thrilled to provide.
Okay. Before I leave you, just want to very quickly ask, this must have been a difficult decision for you to make. I know you mentioned you're an optometrist, but you're also part of the PC caucus. Walk us through why you decided to speak out about this.
So I'm not planning to run again. I've run 3 elections for the PC team. And, we'll save that discussion for another day. But the reality is that I feel that my voice isn't being heard. I worked very hard for the last 7 years on reforming the tow truck industry and ensuring that gangs weren't controlling parts of our highways, which they are. I was promised that it would be dealt with, and it has not. We have not seen the necessary changes. I organized task forces, roundtable discussions, passed through committee, debated the issue in the legislature, and it's still a problem. I had a project for accessibility parking reforms. I worked on doing a presentation for the Premier and his team on digital government and had a lot of recommendations and did a lot of research. I'm hoping to get at least something solved. The Yonge Street subway should be on Yonge Street, not tunneling under homes and going off course up in York Region. I'd love to, make sure that my voice is heard. I felt that my voice wasn't being heard any other way, and I think it's unfortunate that it has to come to this. Really unfortunate.
Well, thank you so much for your time and for your perspective on this. We certainly appreciate it.